Met with Vermont lawmakers earlier to discuss a path forward in addressing lengthy wait times at hospitals across the state. State House reporter Devin Bates joins us now live in the newsroom to break down some of the recommendations. Hi, Devin.
Well, that's right, Lauren. The Agency of Human Services spent last fall trying to get a better grasp on whether reports in the press about those lengthy wait times were the tip of the iceberg or the exception. Now, their assessment showed it's an issue that's having widespread impacts on Vermonters' health, finances, and emotional well-being. Written testimony from Vermonters shows hospital wait times have taken a toll, with one person writing, quote, "I am a doctor, and I told the scheduler it was likely cancerous. They gave me the earliest appointment, a 5-month wait."
They described physical, psychological pain. At least a third of the individuals we heard from said that, that they were experiencing pain while waiting for the care that was delayed and were fearing declining health as a result.
The lengthy wait times existed prior to the pandemic and continued during it. Half of Vermont specialist appointments weren't scheduled within 2 months. The report shows that was far less frequent in neighboring states. Department of Financial Regulation Commissioner Michael Pieciak said within each specialty, there was quite a range between the shortest reported wait time, the average, and the longest.
Looking at dermatology again, just as the most dramatic example, the average was 109 days across all of the specialties. But there were some instances where somebody could get in 11 days. There were others where it would take 410 days. Again, calling for the same reason.
The report also found there's never really been an attempt to collect accurate data on wait times in Vermont. Pieciak wants the Vermont legislature to put his department in charge of that going forward.
If we're not tracking it, if we're not reporting on it regularly, then it's really hard for us to know whether it is a problem, whether it's a problem that's increasing, whether it's a problem that's decreasing and getting better.
Ina Backus with the Agency of Human Services said the same effort will have to extend to related fields beyond specialty care.
We have recommendations for further work in the arena of mental health specifically, as well as primary care.
The report also recommends the hospital should have a designated committee or board member responsible for monitoring wait times at their facility. They're also asking hospitals to share information with each other to improve wait times. Live in the newsroom tonight, Devin Bates, Local 22 News.